Mr. El-Kasab, he's an 85-year-old man. Oh, you should have seen him when he first arrived. I mean, he was cachexic. I mean, he was cachexic. He was very ill. He was having a high fever, and he was in such discomfort you won't believe. His abdomen was markedly distended, and because it was so distended, it was splinting his diaphragm. He had difficulty in breathing, and he had a bad chest infection. The first thing we did, in actual fact, was to explain to his son how ill his father was. And because he was so ill, we had to give them the option of having no further treatment. Although he had flown all the way from the Middle East to Singapore, we felt that this was a patient who was so ill that he could just die suddenly. And so, one of the options in actual fact was not to do anything further, but to send the patient back home. In any case, we discussed and we made a decision that the least we could do was just to make him a little bit more comfortable. We put in a central line and we fed him total parenteral nutrition. In other words, even if he doesn't eat, we will ensure that he has enough nutrition. Then we put in a small pigtail catheter into the abdomen, and every day we will release about 2 liters of fluid. You can't release the fluid very quickly because the body will decompensate and they will go into kidney failure. What happens is that gradually we emptied the water from the abdomen. It began to soften up a little bit. It allowed the lungs to expand. With aggressive antibiotics, we slowly got the chest infection under control. And when his condition was stable enough, we then broached the idea of whether he would like to just go back to the Middle East at that point or to attempt chemotherapy. To be fair, metastatic melanoma is a very difficult condition to treat. It is not a very chemosensitive tumor. Maybe about 2 out of every 10 patients will actually respond to treatment. In other words, there was an 8 in 10 chance that whatever we did, it would also not help the patient. This patient was initially diagnosed to have a melanoma and underwent surgery in Thailand. And after the surgery, they had given him the all clear. And they said that perhaps the abdominal swelling was due to tuberculosis. But we knew that that was not true because the fluid that was extracted was filled full of the melanoma cells. When we did a PET scan, there was extensive involvement in many parts of the body. After careful consultation with Mr. El-Kasab's son, we also communicated this with the family that was in the Middle East. They all wanted us to try, despite knowing the fact that the chances were not high. The patient was started on chemotherapy. We didn't dare to follow the standard protocols that were available because we were dealing with an 85-year-old man, 85 years old. And most people's natural lifespan is maybe 70, 75 years old. To deal with someone who is 85, who's so weakened from his overall illness, it was not wise for us to follow any fixed protocol. We improvised and we gave him chemotherapy very gently week by week. After 5 weeks of treatment, initially we planned 6, but after 5 weeks of treatment, we did a repeat PET-CT evaluation and we were very happy with the results. Besides seeing that the fluid had emptied significantly, many of the sites which we had detected disease had shown significant improvement. Besides the radiologic evidence of improvement, clinically we could see he had improved. He was able to talk, he joked with us, he was able to sit up in the chair, he was able to eat a little bit better. It was tremendous encouragement for the entire team that was looking after him. And we had everybody involved. We had a chest physician to ensure that the lungs would be kept free of infection. We had a renal physician to make sure that the kidney function was good. And we had consultants available to ensure that he was getting adequate nutrition. And I looked after him as far as the cancer was concerned. And I was also overall in charge of ensuring that the adequate communication with the patient and the family. After the initial evaluation showed good results, the family was very enthusiastic for us to continue trying. We pushed on for another 6 weeks, and thankfully, the second PET-CT evaluation showed even further improvement. And now you can see Mr. Elkasab, you know, he's really beginning to enjoy some quality of life. One of our concerns, obviously, is that Mr. Elkasab comes from a long distance away. His only support in Singapore, in actual fact, is from his son and from the medical team. We have discussed the issue several times as to whether he should really just go back and enjoy the good quality of life that we've been able to achieve. But the family is keen on us doing whatever is possible to try to prolong his life as much as possible. The sad truth is, Mr. Elkasab will eventually die of his illness. All we can be thankful for is that we have bought him this period of time, that he has been able to be comfortable. And that's why it's so important for the entire medical team not only to look after his physical well-being, but really to offer him that social support to make him feel as comfortable as possible. So he really, you know, I always call him my father. I say, Papa, you know, or Papa, how are you, you know, and it always brings a smile to his face. And all the nurses treat him like their own grandfather or father, you know, to make sure that he feels that not only are we looking after his physical well-being, but his emotional and social well-being as well.